All right, so today's video is on the surprising health benefits of just walking every day. Okay. And so this is something, um, this is the baseline standard for most of my patients when I'm starting to talk to them about exercise. You're just finding out where they are with any kind of exercise. And a lot of this can even play into people who are injured. And the question I ask is, are you walking? Right. And sometimes people might be like, well, yeah, I can walk, dude. Like, what's your problem? Like I walked in here, you saw that. But then I have to clarify a little bit, like, are you walking on purpose for the sake of walking, right? And to me, even if you're an elite athlete, on some level, walking just for the sake of walking every day or close to every day has massive health benefits. And I want to go over just some of these health benefits and some of my ideas of the why you should walk and also how. There is a how to walk, okay? And we'll talk about that, okay? So, the first thing and I'll try to get a little bit of research in here, but is the first thing is just the cardiovascular and metabolic health benefits of walking. I am going to have to read from some notes today because there's just so many. Maybe that's it. There's so many benefits. I'm afraid I'd miss them all. So if you're someone who walks on a regular basis, you will get a decrease in body fat, which is your BMI, a decrease in blood pressure, a decrease in blood sugar, a decrease in cholesterol, a decrease in just overall cardiovascular disease, a decrease in diabetes, right? I mean, there are so many of these things that we think of as not so great health markers that will come down with just daily walking as far as our cardiovascular system and our body weight. And so I like to tell people that kind of sort of like discount walking, like, well, does that really do anything? That it's like, they think, well, it's just better than nothing. It's like it's way more than just better than nothing. Like there's a lot that it benefits. There was a study that basically showed each 1,000 step increase in daily steps was associated with a decrease of 15% of lower all-cause mortality. Just meaning like for every 1,000 steps that you increase your walking per day, you get a decrease in, you know, all the causes of why people die by about 15%. The second reason is that it is a really low barrier to starting, right? Meaning this is a level of exercise that pretty much anyone can do. Um, I've worked with some people who were, based on a variety of reasons, struggling just to walk maybe a quarter of a mile or even a half a mile, and but had a goal of walking a mile. And we were able to start very, very low. So it's something that you can start by hardly doing anything at all, but it's almost unlimited in the amount of progression that you can go in order to be able to, even get to running if you wanted to. So that's one of the number two real benefit I think to walking is that even if you're at a very low level, you can always start somewhere and it could just be walking to the end of your driveway and back. Okay. So, one thing I want to talk about, this would be more into the how of walking, is the speed of walking. So, let me talk to you about walking your dog. The dog lovers are going to be all upset about this. But there's a solution. But when I tell people to include walking as fitness, I tell them you need to walk with a purpose. And so, what I mean by that is like you're going outside of your house or wherever you are to go for a walk. And that means you're walking and you're not stopping till you get back. Okay. If you can all, if that's possible. Okay. So, um, when I ask people sometimes, like, hey, do you walk? They're like, oh, yeah, I walk my dog. Well, we all know dogs, most of them like to just sniff. They like to smell things, right? Um, and so they're always stopping, they're smelling, they're going to the bathroom. You have to pick it up, all these things, right? And that's great. Um, Walking a dog's actually probably one of the more therapeutic things you can do for your mental health. Um, but at the same time, if you're looking to include walking as a low level of exercise, then walking your dog to me isn't the best thing to do because it doesn't allow you to keep like a steady heart rate for a long period of time because it's a lot of start and stop. So what I recommend people to do is like take the dog for a walk and then go bring them back home, then go for an actual walk. So walking with a purpose, speed matters, right? And so there's a study that came out in 2004, and it found a strong association between faster walking pace and lower risk of coronary artery disease. It said, for an example, fast walking pace was linked with approximately 46% lower risk compared to slower pace. So when I go for a walk and it's just like a normal walk, I'm not trying to walk fast, but I'm not necessarily stopping. It ends up being about 19 minutes per mile. Okay. I would say like a somebody out there just like I want to walk and walk fast, you can easily do 17, 18 minutes per mile. But I would say at least you want to do 20 minutes per mile. And you can time this pretty easily, obviously. Um, so many different watch and fitness trackers and things like this. Even your phone, if it's just in your pocket, will track this. So don't walk with the dog unless you can walk the dog, but then go for a regular walk. Make sure you walk with a purpose. Trying to, I mean, obviously, if you stop and see, talk to a neighbor, fine, that's great. Do that. That's healthy too for a lot of reasons. But if you're looking to walk for exercise, really try to just think of it as if you were going out to walk. You don't want to stop. Walk with a purpose. It matters, and speed matters, and you get more health benefits out of it. All right, let's talk about the third thing is mental health. Okay, so like um, there is a lot of studies that go into there is a decrease in depression when it comes to walking. So one is if you walk greater than 7,000 steps, you get a 31% decrease in depression. These are most of these studies I'm mentioning are like meta-analysis, meaning they look at a lot of studies. And not only does it help decrease depression, but you improve your sleep, you increase your cognition, meaning your memory, decrease dementia, and it's also a stress reduction. Um, a lot of times with athletes that come to see us, maybe who are runners or even just walkers, when they're saying, like, I'm in pain and I can't run or I can't walk, the thing that most of them will tell me is that, this is really important to me, not only for the cardiovascular and metabolic health factors, but this is my way of decompressing, man. This is my way of reducing some stress. This is a way of allowing me to be a better person at home to my spouse and to my kids and um, to my coworkers and things like that. So there's a huge mental aspect to being able to walk and run. And there's this thing, and you could probably look it up, but it's called the canopy effect. And that's where walking outdoors, right? And I guess that's another thing I should talk about is like try to walk outside. I mean, there's nothing wrong with walking on a treadmill, especially if it's cold or hot or everything raining or whatever. But walking outside, being in nature is part of the mental health benefits of walking. But the canopy effect is meanings the canopy of trees, right? So there's been lots of studies that show that people who walk outside in the woods or maybe on a trail that has a canopy effect to it where you're in nature, there was a massive amount of benefit to that. We're part of nature. We were made to be in nature. And yeah, there's just a huge effect to that. One of the last things I want to talk about is one of the things that I like about walking and why it's such a low barrier to entry is you can do it anywhere, right? And I talk about running a lot this way, right? I'm just tease people. I'm like, if you look down and you see your legs and you have some shoes, then you can exercise, right? And that's what's really cool about it. You can be on vacation over in Europe or at the beach or wherever in a city, it doesn't matter. You can almost always go for a walk. The key with this is the consistency of it. Okay. So, um, the best case scenario is if you're consistent and you walked with a purpose, but I would say consistency is even more key than the speed. Um, a study showed that hitting around 8,000 steps um, on most days of the week significantly lowers your odds of dying from any causes of cardiovascular disease. You don't have to make it perfect, but you do need to try to walk. Um, if you're pick a consistency if it's every other day, but walking every day would be great. Um, and you know, and short bouts can make a difference. That's another thing a study brought up. And so this is something personal for me sometimes. some days in the office here where I am here for all day, right? I'll get here around 7 and then I'll leave around 6 and I'll be with patients all day. I may have a little bit of time to do some working out. But when I get home, even when it's dark, like this time of year, when we're here in the fall towards winter, if I feel like I've really haven't done anything else, then I go that day. I'll at least go for a walk for a mile. Takes about 20 minutes. My neighborhood has some hills in it, so there's a little bit of hills involved. Um, I find, and what I recommend to my patients is when you feel the most tired, especially if it's in the evening, or it could be during the day, honestly, is a good time to go for a walk, right? Don't think like, I'm tired, I need to take a nap, especially if you feel like you haven't done anything that day, if you're just tired from like brain stress and things like that. So sometimes a pattern for me can be like, if I get home and I have some emails to catch up on, I'll sit down before dinner time and maybe start working on some emails. But that's most likely a time I would just doze off a little bit, right? Like my brain's relaxed a little bit, trying to work. I'm sitting down, I'm just a little tired. But if I go for a walk, that doesn't happen. And so I get the benefits of the walk of all those things we talked about. Plus, I don't kind of doze off, which then helps me sleep better at night. So but yeah, the benefits of walking are huge. And I just thought it'd be I talk about this so much with so many of my patients, even my patients who are fairly high level runners or other type of athletes, but maybe they're injured and they just need something to do. I'm like, don't discount walking. Go ahead and do it. So these are some of the amazing benefits I find to walking. And hopefully if you are watching this video and you're just thinking about like, getting into exercise or maybe you just see a lot of people walking in your neighborhood and you're wondering about it. That's the whole thing with the weight vest. We've done some videos on that before. Having a weight vest is just another way to get some benefits out of walking. Maybe you've seen that. Then get out and walk if you're not doing it. It's not just better than nothing. There's a huge benefit to do it. Try to do it every day if you can. And I think it'll make a huge difference in so many aspects of your life. Thanks for watching. Please comment below and I'll respond when I have a chance. And I'll talk to you again soon.